Hi, I'm Caroline from EmpowerIn, and I've partnered with nursejournal.org to cover the topic of comparing nurse practitioner and physician assistant career paths. We really hope this video helps you out a lot, and if it does, please do us a favor and give it a thumbs up. Without any further ado, let's get right into the video. When looking to achieve a high tier in your profession, it can be daunting to choose your path. Becoming a nurse practitioner or physician assistant could provide a rewarding and lucrative career. This video will guide you along the path of becoming an advanced practice provider as a prospective nurse practitioner or physician assistant. Let's take a look at the difference between these two roles. Physician assistants and nurse practitioners are educated from fundamentally very different viewpoints. A PA is medically trained from the medical model. The medical model focuses on pathology of the problem and how to cure it. The PA model is essentially disease-centered. A NP goes to a nursing school and is trained under the nursing model. The nursing model focuses on the patient as a whole. The NP model is patient-centered rather than disease-centered. Philosophically, the medical and nursing models differ tremendously. As an NP, you will have different workplace experience than that of a PA. Nurse practitioners work in a range of settings. NPs practice in hospitals, clinics, schools, camps, and skilled nursing facilities. And because they often have the authority to diagnose and prescribe independently, they're also found in nurse practitioner-run clinics or have established independent clinics of their own. PAs typically work under surgeons and physicians in doctors' offices and hospitals, where they contribute to the work MDs do. This means they aren't able to strike out on their own to establish an independent practice. Both PAs and NPs can specialize in a great number of areas. Even though PA programs focus on general medical practice in their careers, they often specialize by area of medicine and practice settings, including emergency medicine, surgery, or orthopedics. On the other hand, NP programs all include a focus in a specific patient population group, family and individual across the lifespan, pediatric, adult and geriatric, women's health, neonatology, or mental health. NPs can also further specialize according to practice settings and disease type. Whether you choose to become an NP or PA, the requirements are similar in terms of the level of education you'll need, even though the focus of the education will be considerably different. The PA must attend graduate school and receive a master's degree either in physician assistant studies or health science or medical science. The NP attends an advanced practice program, either a master's of science in nursing or a doctor of nursing practice, both of which build off the knowledge registered nurses already have. Both professionals have a state license and national certification requirements. The PA must take a general certification exam known as the Physician Assistant National Certifying Exam, or PANCE. NPs, on the other hand, test for primary certification in the patient population that aligns with their graduate studies. If the NP wishes to specialize even further, there are additional certification options in everywhere from emergency care, oncology, infectious disease, and immunology to forensics and nursing and informatics. Both physician assistants and nurse practitioners must be licensed or registered at the state level, and both participate in continuing education to maintain national certification and state licensure. Depending on how licensing is handled in a given state, an NP would either earn an additional APRN license or an advanced practice endorsement on their existing RN license. In virtually all cases, NPs would still be required to maintain a registered nurse license in good standing in order to practice. Both NPs and PAs can diagnose patients and treat diseases. Both can prescribe medication. However, PAs prescribe under a physician license. An NP may be able to seek independent prescriptive authority at a state level, but that does vary by state to state. This means that in many states, an NP may receive the ability to independently prescribe without needing to have a standard care agreement with a physician. Physician assistants cannot practice independently. They are always required to work under the license of a physician. Elements of the Advanced Practice Registered Nurse consensus model are being adopted in many states, allowing NPs to practice with more autonomy and greater independence. In many states, they may practice and prescribe completely independent of a physician. This is a very exciting time to become a nurse practitioner because independent practice is spreading. Even if your state is not yet allowing independent practice for advanced practice nurses, many states are headed in that direction. PA versus NP salary. PAs and NPs have different salaries, according to the United States Bureau of Labor Statistics. A physician assistant earns a median salary of $101,000 per year. At the top of the salary range is $142,000 annually. Nurse practitioners make an average of $104,000 annually. The high end of the NP range is $140,000 annually. Both career paths have an excellent outlook, with both fields growing and creating new job openings. Physician assistants and nurse practitioners are both valuable and necessary careers in the health profession. While there are some similarities, you should be clear that these are two distinct professions. Both roles have profoundly different fundamental models. While you decide your path, it is important to look to the future. Both have amazing salaries and job outlooks. With more states adopting the elements of the APRN consensus model, the future is bound to get exciting for NPs. Thanks so much for watching, guys. We really hope you enjoyed the video. Make sure you visit nursejournal.org, a popular social community for nurses worldwide. One of the best features is this page right here, which houses over $200,000 worth of scholarship opportunities. This is just the start of what they have to offer. Click here to visit nursejournal.org.